Thanks, Tyler. Good afternoon, everyone. My name's Manish Goyal. I'm a general partner at Merger Tech Health Ventures. We're an early stage fund located in Newport Beach, California. Just helping Andrew out and trying to do my best job impersonating Will. Next up, we've got a rather exciting company, Rise Health. And if you could help me welcome Gino, who's president and COO. And have you guys tell us a little bit about what you're doing.
Great, thank you. Hi, I'm Gino Tenace. I'm President and Chief Operating Officer of Rise Health. With me is Jeremy Boyer. He's a senior analyst on our, who has helped build the application that we're going to talk about today. We're going to talk about our primary care dashboard. It's actually our second time at the Datapalooza. Last year, we were here to talk about another part of our technology. We won the best app for that technology, and when we won it, our CIO and I jumped up like we had just won the Price is Right. Hopefully we won't have any of that, but if any of you feel like jumping up out of your seat after you see what we have today, feel free. A little bit about Rise Health. And first, I want to thank all the people who've put this together with all the various other shows going on, or other rooms with other demonstrations. There's a lot to see in this Datapalooza this year. So first of all, what is Rise Health? Rise Health is a healthcare services company. Next slide. That is trying to solve a fundamental problem. So the Institutes of Medicine, one of the sponsors here, talked about the healthcare system is in need of fundamental change. And that's what Rise Health was organized to do. We are a technology-enabled services company built on a vision not too dissimilar from patient-centered medical home or similar concepts, that team-based, value-driven healthcare that's centered around primary care has an opportunity to fundamentally change the way healthcare is delivered. And we do that with a number of capabilities. First, process management consulting, help primary care to reorganize how they fundamentally deliver care. A set of extended care team to add to that primary care team, a decision support tool, which is what we came here last year with and won the award, our patient relationship manager, and then finally a set of measurement tools. And what we'll show you today is our primary care tool. So what are we trying to get after? Fundamentally in primary care is the source to fundamentally change and get after the changes that we need in healthcare. But how do you understand how to improve access, how to improve patient flow, how to improve the quality of care that patients receive? How do you really manage medical costs and get after medical costs in a fundamentally different way? All trying to understand how you optimize the patient experience, because without the patient experience, without them feeling like they're really part of the care team, they're really not going to be able to, they'll vote with their feet and they'll go to other parts of the healthcare system. So what we've done is fundamentally pretty simple, and I'd like to start before going through this with a story. We were with one of our customers in Boston. We were sitting down with one of the leads and primary care doctor, and we asked her about the information that she received, and she said, well, I have this great information. She went into her desk drawer, and she pulled out a report. And the report had been one that their IT department had put together. It was a very good report. And our chief analytics officer said, okay, what do you do with that report? And she said, I showed you what I did with that report. I put it back into my desk drawer. So there's fundamentally two problems with our data today. One is it's not in real time. It's not actual. It's not there when our doctors can really use it to change healthcare. And two, it's not in real time. And it doesn't have all of the data that you might need in real time to make decisions that can fundamentally impact the way you care for your patients. So we do what a lot of people have talked about doing. We collect data from a bunch of disparate data sources. We connect to the EMR and EHR to get that data. We connect to the PM system to get that data. We connect to our own system, the patient relationship manager. We connect in real time to ADT systems of the hospitals and to SureScripts and to LabCorp and Quest. And we bring all this data together, but we also bring it together with things like patients' phone calls and their faxes and their emails. And how do you bring all that together to have one complete picture of the patient? And then how do you bring evidence-based medicine that's abundantly available? We've heard some of that today. How do you bring that and put it in at the same time? And then how do you feed two fundamentally different systems? One a reporting system and the other an operational system. So you can see the problems in real time, identify where your issues are, and then direct it over to your operational system where you can do something about it. And we'll show you our reporting system today, but stop by booth 16. We can show you the rest of our technology. So Jeremy's going to switch over to our dashboard. And we're live. This is a live version of our dashboard. It's de-identified, so for obvious reasons. But what it is a set of 56 or 55 different measures that cover the plethora of primary care issues that you might cover. What we talked about before, basic information about your panel, basic information about who's coming to see you, how often are they coming to see you, how efficiently do you use all the healthcare resources, not how many times not how many times the patients come and see you in the office, but also how many times do they have to call you to get basic information out. We have new metrics like care coordination. How do you know, do your patients really come and see you, or are they going to see somebody else for the predominance of their care? And then how are the other healthcare resources being used, ER and inpatient, of course, quality of care metrics. And this is at a customer level, but how do you quickly then drill down if you decide, well, I want to look at this subset of doctors? We can very quickly, with just a touch of the screen, identify this is a set of doctors that we want to see something about. So you can see where we still have the group's information, but now we're able to compare that group's information to these subset of doctors. Or if you wanted to select one of the practicing suites, this happens to be an academic medical center, and you want to look at how does that suite compare to all the other groups. But it's not important enough just to be able to see that at a high level. What are the physicians and how they practice? You then need to be able to drill down on a patient level and very quickly say, what about the individual patients? What's all this data and how the individual patients make that up? So very quickly we can get to a patient registry that gives us all the patients that we just selected from that subset of providers and their unique information about it. And by the way, if we want to say, what if I want to know all my patients in this group of physicians who are diabetic? And how about all those diabetic patients who are also depressed? And how about just the diabetics who've depressed that haven't come and seen me in the last 6 months? And very quickly, we can drill down and get that subset of patients. So while Jeremy was all doing that, now we can see 22 patients that are from that subset of doctors who are diabetic, who are also depressed, who we haven't seen in 6 months. And with a click of a button, that information can very quickly get over to our operational system so we can run a campaign. Perhaps we want to do an outbound call program to see, why haven't we seen you in the last 6 months, and what are the care gaps we need to close for you? At the same time, we can very quickly go back to, what if I want to have different statistics about this group? So if we remove all that information that Jeremy just put together, there's also some visual cues, like our last presenter that was talking about geographic cues. We like to use charts, and with very easy click of a button, a big issue for us is coordination of care. Are my patients coming to see me? So we can say, what are the physicians who have panels of greater than 400 patients who have less than 50% of the time the patients see them? The other 50% of the time they see some other primary care doctor. So with that very quick click, we can identify the 7 physicians who have greater than 400 patients in their panel who have less than a 50% care coordination. We can go back to that same patient registry now and see that subset, we've narrowed down to that subset of patients. So there's 4,900 patients that fit into that group. And then again, drill down on who are those patients who are diabetic, who are those patients who are depressed, who are those patients who haven't seen us in 6 months. And again, make an actionable campaign. All click a button. This is all released over the internet, so our doctors can sign in anytime, get into their data. It's updated constantly, so every new phone call comes in, updates this data. Anytime somebody's walked into the emergency room, feeds our operational data and feeds our reporting data. Anytime a patient has a care gap or they have a new lab result, updates this data, so the doctors can identify those campaigns, find the kind of information they want about their patient, and quickly get it over to their operational system. So again, it's about how do you use all the information out there? How do you create actionable data out of that information? How do you find out what's important? How do you feed both your operational system and your reporting system? Any questions about our primary care scorecard dashboard? Okay, well, I think we tried to get them back on track. So thank you for your time.